Welcome to Global Talks by PavLyfe, a podcast about redefining healthcare through a global perspective, allowing you to become informed and involved. In each episode, we deliver the best hard-hitting analysis and discussion of what is currently impacting the healthcare landscape, with guests from a variety of industries. Now, here's your host, Pavan Lohia.
Today we're going to be discussing the urgent need for medical supplies for our frontline healthcare workers fighting the COVID-19 outbreak. I have with me the game changers who are leading the way in helping provide these supplies for our frontline healthcare workers right now. Thank you and welcome to the show. I have Nick Digirolamo, Amir Hassan, and Dr. Mark Schultzel. Thank you for joining us, gentlemen.
Yeah, thank you.
Thank you for having us.
Thank you for having us.
Of course. So I'm so glad you guys could join me today and discuss everything you guys are involved in. I know all three of you attend the University of California, San Diego Rady School of Management. I wanted to know a little more what brought all three of you into healthcare, and I'll start with you, Dr. Schultzel.
I'm an orthopedic surgeon. I specialize in shoulder and elbow surgery, and I'm the SuperSpecialist for shoulder surgery for the Sharp healthcare system. I came to UCSD for college, and I stayed for medical school, and I fell in love with the city, so I ended up deciding to come back to town to practice medicine.
Oh, wow. And you also currently serve as the student board president at the school too, right?
Correct. Yes, I'm in the flexible weekend program, and I'm the class president for the Rady Student Board currently.
Awesome. How about yourself, Nick?
I'm actually not in the healthcare field. I have a project management background, but with this global crisis, I felt like I could have an impact on this cause with the supply chain. Of
course. It's much needed right now. And, I think a combination of all skills between healthcare, business, and converging all those is extremely important. And last but not least, Mr. Amir, what brought you into healthcare?
Yeah, so I just graduated from the University of California, Irvine back in the spring of 2019. My degree was in human bio, and I've been in, the healthcare sector, working in hospitals and in some clinics. Right now, I'm getting my MBA, just like you alluded to, at the Rady School of Management, hoping to further my career and my educational career and going into medical school and going from there.
Awesome. Oh, that's really good to hear. And, combining your expertise in biology and business are a great way to go, especially into medicine. So as we all know, we're dealing with a global crisis of COVID-19 right now. And I know all three of you are doing amazing work and helping frontline healthcare workers. But just before we get into it, I wanted to know your take on the impacts that this has had, not only on businesses across the country, but even our national economy, and what impacts that brings upon these people. So Nick, if you want to start with how you feel.
To me, this entire thing's been very eye-opening. The reaction that people, obviously, I would say the evolution of the reaction people have had has been pretty incredible. It started out where the uncertainty of what the impacts would actually be was not clear, and now that we're starting to see a little more of the impact on the global economy, I think it's really important that, like you said, we gather people from different backgrounds to help out in the effort.
Absolutely. And Dr. Mark, I wanted to ask, so you've definitely had experience as a physician, and now you're experiencing the business side of it as well. Have you seen that affect, working, being in a hospital or clinic?
Yeah, certainly. For me, I'm actually a private practice physician, so it has taken a big toll on my practice. We furloughed most of my staff, and We've gone down to working nearly completely telehealth, except for emergencies. I know that there's many practices that have completely shuttered their practice, except for emergency cases, and most surgeries have been shut down unless they're life or limb. My twin brother is actually a colorectal and robotic general surgeon here in town as well, and so he still is operating, but he's mostly doing colon cancer cases or appendectomies on call, things that patients absolutely must have. But, it isn't without great risk to, the surgeon, all the staff, and the patient as well.
Of course. And have you personally, or even your brother or anyone you may have known, have you had any issues recently with obtaining personal protective equipment or other important medical supplies?
Absolutely. In a couple of the health systems that I work in, they had run out of PPE. And even in some of the health systems, some of the nurses were told that they were not allowed to bring their own in. That recently has changed. So I think now Kaiser Permanente is allowing their nurses and doctors to bring in any PPE they'd like. Sharp, Scripps, UCSD, all the other ones in our community have been more permissive from the start about PPE. But we've definitely seen that we're lacking it. I know that there's a lot of doctors, both here in San Diego and my friends around the country, that are reusing their masks, washing and sterilizing gowns and face shields and things of that nature.
Right. And I'm sure you've seen the headlines recently, healthcare workers either being reprimanded for not using their PPE effectively or not reusing it, or, it's a very concerning thing. And, ultimately, it's going to impact how this disease progresses and impacts more people. So I really hope we're able to fix these issues in a more appropriate manner than the current response we've had. And
absolutely. I think, California has been able to flatten the curve much better than other states. And I think that as a country, we've been well prepared. But I think just like anything in life, even if you think about disasters, you're never really prepared for it until you've experienced it. And so I think, looking at it from an outside perspective, we were watching other countries go through this and realizing it was going to be bad. But I think you never understand how bad it is until you have to live through it.
Of course. And I think this begs the question is, have we just not prioritized the need for this type of equipment prior? There were reports that, even places like New York, had the opportunity to have extra ventilators and whatnot, but they simply refused to. And now you have a system where you have 50 states, having bidding wars to get these supplies to people who are desperately in need.
Yeah, I think Nick can also speak to this as well, and Amir as well. But, we learn in business school a lot about supply chain, and there is always a great cost to holding inventory. And so I think nobody could have predicted that there was going to be this sudden need. And so when everything is fine, you try to keep your inventory costs low and purchase what you anticipate you're going to need. And I think that it's probably outside of the realm of possibility that anyone could have predicted the need for this many ventilators so suddenly, or this many hospital beds. But, part of supply chain economics in any industrialized nation is try to keep your inventory cost low. And a lot of this is, just in time delivery for goods, which is kind of the way that the world runs.
Yeah, of course. No, and I think especially, coming from a public health background myself, I think converging public health and supply chain is going to be crucial, especially what we learn from this for years and if not decades to come. And which brings me to you, Amir. I know you're involved in business as well, and I wanted to know, what have you seen? What type of impacts have you seen that take upon your businesses?
Yeah, so my family is involved in the gas and oil business. We own and operate over 100 Chevron gas stations across Southern and Northern California. And it's immensely impact our business in terms of volume. We're still open. Our doors are open because we are an essential business, and we're doing everything we can to help, limit the transmission of COVID-19. But just as Dr. Schultz had to go through, we had to furlough a lot of our staff. We sent all of our staff from our headquarters in our offices home. We're limiting we're limiting each gas station to one cashier. And then each cashier is wearing gloves and a mask. And we're also requiring them to clean and disinfect any high touch surfaces at least once an hour. So it's, dramatically changed our operation and reduced our volume a lot, but we're not complaining about the reduction in volume. We understand everybody needs to be at home.
Absolutely.
Everybody needs to obey these stay at home, actions that the governors in their states are taking. So that's fine.
You especially, have a very unique business because, gas stations obviously serve a vital need for transportation, but, also convenience stores in many areas that are underprivileged and whatnot. Did you experience any of that, especially with the concerns of price gouging or, limited supply of many essential needs? Your average gas station convenience store has quite a lot of stuff that people use on a day-to-day basis. So I'm curious to know, was there a surge in, traffic to purchase some of these much needed essentials?
Oh, no, definitely. I mean, our stores sell anything from, snacks and chips to water and paper goods and even ready to eat meals. And we have delis in some of our convenience stores as well. So we've experienced very heavy traffic, and we're not being able to be restocked as quickly as we used to be. A lot of our vendors are running out of stock. Their supply chains are choked because, as you all know, this crisis started up in China, and China has become the leading exporter of, consumer goods in the past
Absolutely.
decade. So it really choked up the supply chain from the manufacturer to the distributor and all the way down to the consumer-facing convenience store.
Of course. And, we've obviously been talking a lot about supply chain, and I think, just to give everyone a, little glimpse of what that really means, Nick, do you mind telling what, supply chain really means it in simple terms?
Absolutely. So in simple terms, I'd say it's every step of the process from the first piece of material that goes into a product to POS, like Amir was saying, to sale to the consumer. Everything in between, all those individual steps from manufacturing, distribution, all the way down to retail is all part of the supply chain, which, like Amir was alluding to, has been drastically affected. Each piece has been drastically affected by COVID.
Absolutely. And Dr. Mark, I wanted to see, I'm sure supply chain, obviously in the business world, is being drastically impacted. What would you say is probably the biggest issue with, healthcare supply chains in general?
Yes, absolutely. So aside from the PPE, we're actually having difficulty with obtaining some medications, surgical gowns. My parents use losartan, which is an antihypertensive medication, for blood pressure. And we have real worry that they may not be able to receive refills, especially because now it's being investigated as a potential medication to help with COVID. We're actually seeing that there's been a run on hydrochloroquine, a medication also known as Plaquenil, which is for lupus patients. And We've even had issues where a few healthcare systems here in Southern California have been refusing to fill the medication for existing patients with lupus because it's also been another one of those drugs that's been on the list for potential help for COVID. And so, even some of I have a colleague she's an orthopedic surgeon like me. She's a hip and knee replacement surgeon in a large HMO system here in San Diego. She couldn't even get a refill of Plaquenil for her lupus, and she's a doctor in the system. So, I find that ethically reprehensible. And we don't even really have too much of a need for the Plaquenil just yet. But I think it's because people have real fears that those medications won't be available because they're not. Pharmacies are not getting restock.
Right. I think just going off of that, do you see the pharmaceutical industry playing any role in, disrupting the supply chain or possibly even helping it?
I think that the supply chain is trying to be remedied by the companies. The problems are actually goes back to what Amir was mentioning before. A lot of our medications, especially the generic ones, are made in China. And so the supply chain's been disrupted. And then additionally, now there's been questions about the safety of these medications. You may have seen in the news that Zantac has been pulled off the market by the FDA. That that medication is made in China, the generic form, and so there's been questions about whether or not it's even carcinogenic, meaning causing cancer. And so I think that this is going to create a shift once everything is over with. We're going to see a huge shift in where we get our pharmaceuticals. I think we're going to start bringing a lot more pharmaceutical production back to the United States. Also, using our colleagues in Canada, Mexico, and Europe to kind of turn inward on creation.
Absolutely. Yeah. And I think from my perspective, what really concerns me as a public health professional is that the healthcare industry itself is so fragmented, from the delivery of care to the services that are essential to populations in need, the underinsured population, plus where we obtain our drugs and how they're priced out to people, and especially in times of emergency when countries may not be able to deliver on certain goods or certain chemicals that are required, it can be a real trouble. I think the entire COVID outbreak has really highlighted the need for some baseline communication from countries to report, disease outbreaks or, market turmoils that can ultimately affect the global supply chain, as we're seeing now with issues of people not being able to obtain face masks, to hand sanitizer, to even hand soap. There's the joke that, were people washing their hands before and whatnot, but, it's definitely, it's not a laughing matter anymore when we have tens of thousands of people dead and, over 1 million plus people now infected worldwide. It's truly astonishing.
Absolutely.
I think from all three of you, I definitely want to hear what solutions do you guys think are possible moving forward? Feel free to discuss that.
Talking on the supply chain frontline, I think Mark alluded to this. One solution that we must bring to the table is making sure we're not reliant all on China, right? It goes back to the old saying, don't put all your eggs in one basket. Two of the last pandemics or health crises that have happened in the past 2 decades have come from China, with SARS in the early 2000s and now COVID. So you would think that we would have learned that, we shouldn't move all of our manufacturing or most of our manufacturing to China, and especially pharmaceuticals, which are so vital to so many people's lives. We shouldn't rely all on one place, right? I think that's a solution, or that's something that we must fix and attend to. I think something else that our health administration on the federal level needs to account for is, why didn't we take more action sooner, right?
Right.
We saw the things happening in China from December, and then Italy got hit. Nothing was going on. I think it didn't really start getting serious until the NBA I think the NBA kind of kicked it off, right? They stopped their games, and then after that, you got the stay-at-home mandates from many states, if I'm not mistaken. I think that's the correct order. And then Disneyland shut down their resorts. So it kind of took one domino to fall for everybody else to follow.
Absolutely.
In my opinion, it should have been the federal government or the health administration that really said, taking the lead on this and said, we need to do this and do it now before it gets really bad.
Right. And I couldn't agree more. I think, in a public health perspective, this highlights a lack of investment in global public health. I always think when people talk healthcare, and I'm sure Dr. Mark has some input on this, is, people think healthcare, they think, I need to see a doctor, I need to get treatment, and that is my healthcare. And we simply know that it's not just seeing a doctor and, taking a medication, but also, the combination of all the factors from that have led up to it, with no healthcare infrastructure to deal with the surge of patients. There's no reporting between countries. I mean, even here in the United States, we're seeing the reporting of cases to the federal agencies has been lackluster, right? I mean, there's actually no central reporting of actual cases. So they're at, many of them, it's upon them to report, but not mandated to report. And I think that becomes a very challenging thing for the federal government here in the United States to then address what is the best way to shut things down or mitigate the exposure, and additionally, even so, local level officials, state level officials, and federal officials, they all operate in such different capacities. It is difficult to deal with that in a time of a public health crisis versus a national disaster or an act of war. And we've spent a lot of time protecting ourselves from war, from outside intrusion, but unfortunately, that has also now led to us not being able to take care of our very own citizens. And I think that really speaks volumes. And ultimately, I would hope that it shifts the minds of people going forward to really, invest in their health, invest in the public health, and, just betterment of communication as a country. I'm sure, Dr. Mark, you probably have some input on that.
Yeah, absolutely. I mean, I think I agree with what you're saying. I think really 5 things need to happen for us to, as a country, and I think as a culture, one, stop this from happening and prevent it from happening again. I think, like Amir was saying, absolutely looking inward on our manufacturing. That way, we're not as reliant on other countries for especially important goods like medicines. And that way we can control for the quality of our goods, because we know that as a country, the United States is the gold standard for a lot of medications and medical practices. And so we really shouldn't be using a lot of the other countries where there may be some questions about the quality of their goods. The second thing is really, as a country, we need to put pressure on the World Health Organization and really look at restructuring the CDC. I think CDC, us doctors are becoming very critical of them, because if you look at their stances on PPEs, they literally change by the way the wind blows. So some days it's like, okay, you should all be wearing masks. And then a week later, it's okay, you can wear bandanas, but yet this disease is airborne. And so it shows that we're really not being supported. The WHO really needs to be taken to task for this, and they need to make a much greater role at shutting down wet markets, which is really where this disease, we think, started. And we know throughout the most recent history of the past 25 years that the majority of outbreaks of very severe and deadly diseases have actually all occurred in wet markets. And if listeners are not sure what wet markets are, these are they're live animal markets where many animals are in close proximity. Most of these animals are not domesticated, and so this allows for kind of crossbreeding and jumping of species. And so, but for the last SARS outbreak was traced back to a wet market, which was basically the predecessor to this disease. Right. Thirdly, as a culture, we really need to learn about really what social distancing means. While this was all going on, there were still big parties occurring with spring breakers in Miami and in Mexico, things like that. And I think people didn't take seriously, how maybe a few days of fun is going to affect you and your neighbor later down the line. And then, the fourth thing that I think is really important is looking at the way that we practice medicine here in the U.S. You guys may not be aware of it, but that we have, each state has its own way of doing their medical licensing. And so as a Californian, I can't practice in any other state in the union, even though I've been trained, in the United States. Each medical board, as a way of making money, charges a huge cost to each physician for medical board in that state. So I have my medical license in Kansas, Missouri, and California. And I had to purchase all those, and I have to pay for them every year. I know those are the only states that I'm actually accredited to practice medicine in. It's interesting that has been completely suspended now due to federal emergency order. So we can practice medicine in any state in the union now on an emergency due to this coronavirus. But in my mind, we should have been able to mobilize that a long time ago. We should have been able to pull doctors to New York and New Jersey,
Yeah, absolutely.
A long time ago. And then, which brings me to my last thing. I think we really need to take a look at oversight of both hospital administrations and then also the pharmaceutical company.
Right.
I am all for free market economy, but the pharmaceutical industries are charging very, very high prices and benefiting off the suffering of others. And I think that they should make money for what they do. The income that they generate helps promote R&D to make new drugs, but it's definitely reached a point where it's, not helping others. Hospital administrators as well do little care for patients and little support of the healthcare workers who are on the front lines, but are still taking home full paychecks. So, doctors are getting furloughed now, are losing their 401ks in hospital systems, and are essentially working for free, but the hospital CEOs are taking home their full paychecks. And I think that that's also wrong.
Yeah, no, that is absolutely devastating to hear. And I definitely think, there'll definitely be a shift, I think, as a country, and I'm sure there'll be a global shift in the attitudes that are around healthcare and what healthcare really means. I can't emphasize that enough, from our pharmaceuticals to, clinical care. I think definitely in the next few months and in the coming years, we'll see very drastic and hopefully meaningful shifts in improving the overall outcomes. The U.S. has lagged behind for many years, and key components of healthcare. We definitely have a lot of health issues that don't exist in other countries, from diabetes to cancer to even gun violence. Has been considered a health issue. So they're very serious issues, and hopefully we're able to get to the bottom of this once this crisis, starts to alleviate a little and have more, responders and healthcare workers work more efficiently. But apart from everything that's going through chaos right now and things running out and whatnot, I want to obviously switch to a more light topic of what is actually being done now to help fix and remedy this situation. I know a lot of corporations stepped up to help employees, cover costs and, not have to pay for certain things like rent. I know has been an issue in the country. But you yourselves, all three of you, have been very involved, obviously within your own school, but also the three of you have teamed up to start this project. I think, we have a lot to learn from everything that has gone on in the country, with the toll it has taken on our first responders, our healthcare workers on the front line. Everyone is suffering right now. People are out of jobs. People have not been able to pay their rent or, afford their groceries. And I think, it's put the country in a very tough position. But at the same time, despite all the negativity that has been seen, or all the situations that are never going to end, as healthcare professionals, as business professionals, I'm sure we always have to see a light at the end of the tunnel. And I'm very glad that a conversation like this is taking place, because we're seeing the intersection of business and healthcare. Anyone who thinks that healthcare is not run that way, it's not necessarily the case. It's a system. It has a lot of processes that are involved, and a lot of them have to pertain to a business. People have to make a living. Bills have to be paid. Science has to be funded. It's a very complex system, but and I think it requires constant effort to upkeep that. This is a great learning example for not only people like yourselves who are learning as you are all professionals at the same time, and I think that's wonderful. I'm sure you guys would agree that being in a university environment as well as being frontline professionals definitely plays a unique role now.
Absolutely. I think we're lucky in that we have, at least from my experience at Rady School of Management has been, as we have business school students that come from all walks of life and tons of professional experiences, and enrich each other. I learned so much from my classmates, and I think I noticed that everybody has the genuine desire to help each other.
Yeah, and I mean, just to go off of that point, not only the students, but also the faculty and staff and administration, right? It was like we started talking about doing something together, and all of a sudden we got a jump on from the Career Center. We have this thing at Rady called Start R and the Center for Innovation and Design, which is made for startups and other business ideas. And they contacted us and offered their help and services. So it's not only the students that are putting themselves out there, it's also the administration.
Yeah, just to go off that, I would say, the response from the Rady community in general for this effort to combat COVID has been incredible. The community in San Diego has also been amazing. It's eye-opening to see that something like this pushes us all together and toward one goal.
No, that's great. And just going off of the efforts that all of you are doing, I know that all three of you have teamed up to create a wonderful opportunity to give back to the frontline healthcare workers. I've been very glad to be a supporter of your initiative to provide reusable masks to frontline healthcare workers. So if you all would please share what inspired all of you to start that, and what can we expect to see out of this project?
Yeah, so first of all, I want to say thank you to you and the PavLyfe Foundation for being so generous with your donations and matching donations of up to $150, which is awesome. Just to give a little feedback, we started the GoFund Me page just about 48 hours ago, and we're now above $2,200, right, Nick?
Mm-hmm.
Yeah.
Mm-hmm.
So we're above $2,200, and a lot of it was from you, and so we really want to thank you for your help with
Absolutely.
that. So like basically what started it off was we had just got on spring break when all of this was going on, and another student from our class sent out a message to the entire cohort, and basically was reaching out and trying to see if people wanted to or kind of just trying to push people to do something, bringing our business minds and all of our different expertise and just together to work on something. And she reached out to me personally, and I reached out to her, and we were talking, and this idea kind of sparked in my head of let's go and make 3D printed masks. And so I reached out to a couple different companies in the local area that make 3D printed parts. I found a design online that was made by another physician, and he made it an open source file for anybody to use.
That's incredible.
So it's really incredible to see everybody around the nation working together on this. So yeah, I took the file and I presented it to a 3D printing manufacturer here in San Diego, and they took on the role. And then I reached out to Nick and Dr. Schultzel to come on and try to spread the word, try to reach out to hospitals, clinics, the Rady School, the UC San Diego as a whole. And I think Mark has reached out to even local companies in the area as well.
Absolutely. I mean, I think it speaks to the strength of our community. We have, the three of us are in different classes, but I think we all felt a need to get involved. And I think there was never a feeling that grassroots efforts don't help. We have another concurrent effort going on where our classes have raised money to help fund the facilities employees who have all been furloughed, who take care of us and make our experience great at Rady, so that we can actually so we financially support them as well. So when Amir called me about this mask opportunity for our public, I thought this was a wonderful campaign to be a part of. And so now we're in the process of getting these masks, which are, they're washable, they're reusable, and they're sterilizable. They're made of a plastic-like substance that can be molded to the face and heated. And so the purpose of them is to really magnify how your PPE are used. And so you can take existing disposable masks and cut them into squares or rectangles. And so one disposable mask can now be magnified to last for 6 uses of these rewashable masks. And, it's much safer than having a bandana across the face. It's going to prevent a lot more particulate matter. And so Amir has already contacted and gotten our masks up to the Orange County and LA Sheriff's Office, UC Irvine Medical School. We're currently, planning for UC San Diego as a whole, as well as UCSD Health and Medical School. And we've been talking with all the hospitals in the community, and then Trader Joe's and Ralph's and some other companies in the area to help distribute our masks.
Wow, you all are hitting every point there, all possible avenues. That's incredible, and I think this just goes to show the resilience of the human spirit to work together and really bind together during a time of crisis and help those that are truly in need. And I can't believe that you all have been so successful and are able to provide this. So I know you just started the GoFundMe page a little while ago, and the amount you've already raised is phenomenal. And I'm sure, especially once more people come to know the efforts, I would have no doubt that they would love to give and help support your cause. But what type of goal do you all need to hit, and how best can we help you achieve that goal? Whether it's through giving donations, do you need any support even distributing these masks?
So right now, it's tough to say what our goal is. Obviously, we're trying to have as much positive impact as possible on the community. So
of course,
for now, we are sky's the limit, kind of trying to raise as much money as possible. That's it, to get this mask out.
Yeah, I mean, basically the ultimate goal, we're not trying to, right now in our GoFundMe, which has the name of Masks for Our Healthcare Heroes, just in case anybody is trying to look it up.
Absolutely, and we'll definitely share the information, how to get linked up to the GoFundMe, and as well as all of your contact information.
Yeah, thank you. That'd be awesome. But so right now it says a goal of 50,000. But there's no limit, right? If somebody needs these masks, we'll give them to them.
It's absolutely wonderful what all of you are doing, and I'm really glad to see how this project has done so incredibly well in just the past few days. I'm sure in the days to come, even weeks, all of you will have tremendous support. We're definitely big supporters here at PavLyfe, and any efforts we can contribute toward, we'll be glad to. But in terms of the mask itself, you were describing it's how it could be reused. How does that help the situation as it is right now?
Yeah, so I think Dr. Schultzel alluded to it earlier. So as a disclaimer, this is not an N95 mask. It hasn't been approved by any agency that said this N95 certified or anything like that. But okay. What it does do and what it is helpful for, because many hospitals are running out of PPE, they're having their doctors use fabric from home or reusing surgical masks, which is very dangerous. What this does is it takes one surgical mask or one N95 mask. You can cut it up into about 6 2.5-inch squares and use that square as a filter, right? So it basically takes one mask, one surgical mask or N95, and is allowing it to be used for 6 different physicians or healthcare professionals. Or you can take one mask and use it over 6 different occasions for the same person, right?
Oh, wow.
And on top of that, it's the material that the mask is made out of is called PLA, which is the 3D printing material. And That material is a kind of like a hard plastic, so it allows you to disinfect with any disinfectant product, alcohol swab. The only thing you can do is you can't boil it or autoclave it, because just as Dr. Schultzel said, you can heat this up and mold it to your specifications around your nose, your cheeks, and your chin. It creates a tighter seal.
Oh, wow, that's incredible. You all wouldn't be happen to be creating sanitizing equipment too, right? Because we definitely need some more sanitizer in this world right now. $400 Purell is really not a thing.
It's funny you mentioned that. We actually have some UCSD alums who have started Cutwater Spirits, who are converting their alcohol production actually into alcohols for sterilization and for hand sanitizing. Yeah, and they've been actually donating them around the town. So, UCSD, their kind of motto is think differently, and they're really big with our alum doing and students doing grassroots events, and that's another example of another great success.
Yeah, I was genuinely shocked to even see that people were using hand sanitizer of all things, and masks especially, as ways to really price gouge and restrict this much needed supply to the healthcare workers, and especially the people most vulnerable to the disease. And Doctor, I have a question for you. I think there's a lot of misinformation or not enough information. What is the difference between somebody wearing a surgical mask, N95 mask? Who needs which mask, and do we need to wear it?
Yeah, so I actually spent a lot of time growing up in the Far East, in Japan and China, and so I'm used to growing up wearing a mask, and so I think for Americans, I think prior to this, I think people would see a mask wearer and have fear about what was going on.
Of course,
in Asia, my understanding of mask wearing is really for two reasons. One is if you're not feeling well, to, almost as something to be respectful to your community, so that you're not sneezing and coughing on other people. And then and also to protect yourself from others. Masks are not perfect. And so even the masks that I use in surgery, airborne pathogens could go through. They're really fluid guards, to be honest. So if someone sneezes or coughs, and droplets can be prevented from getting through the mask into your, the mucosal tissue, so into your mouth or your nose or your eyes. The difference between the surgical mask and the N95. So the N95 masks have much tighter fibers, and then they create a seal around the face. The problem is that we healthcare workers actually have to get what's called fit tested, which is you put the mask on, they put a bag over your face, and then they spray you with a foul smelling liquid, and we test to see how long it takes for that to pass through, for you to notice the odor. And so, for these everybody has a different face shape, so you actually have to find the type of mask and the size that will fit you well. I think anything is better than nothing, but I think that is, a qualified statement, in that even some bandanas probably will trap moisture. And so, I think it's better to have some sort of a mask, to be honest. But I think the more important thing is to truly do social distancing. I think Californians have actually done it pretty well, but it's keeping people 65 and over, or people with any health condition of the lung, or poor health in general, in the house 24/7. Have friends and family or neighbors get them groceries. Just don't go out for any other reason aside for getting groceries. If you're going to go for a walk, maybe a short walk around your community, but not very far. I really don't recommend people going on long runs or running down to the beach or things like that. It's just, we really feel like this disease is an airborne pathogen, and so and can stick around in the air. So it's just, don't put yourself in any other risk. And then even small gatherings, I think, should be avoided outside of your immediate family that you see every day. So if you live with somebody, that's fine. But, going and coming to friends' houses, even in small groups, if you think about it, where have your friends or family been? And so you want to limit the number of contacts that you have with other people, and by as many degrees of separation as you can do. And so for hand cleanliness, washing your hands is still always better than hand sanitizer. You should wash for 20 to 30 seconds. Pick your favorite song, sing the refrain twice, and that's your, the time to to wash your hands and just practice good hygiene habits. Clean your surfaces, clean your keys, your doors after use, and things like that.
Oh, of course, then that is very important advice, and it cannot be stressed enough. And thank you so much, Doctor. Very well appreciated. I'm sure everyone out there is doing their best to take those precautions, and please continue following them. But I just want to make sure I reemphasize to everyone out there that's listening is so right now while you are collecting, raising funds to get these masks created, do we have an expected timeline of when these masks will be available for distribution and the opportunity to how long people will have to donate?
Yeah, so right now we currently have 500 of the masks in production. We got a generous donation from H&S Energy for 500 masks. 300 of them will be going to OC Sheriff and LA Sheriff. And then about 100 of them will be going to the UCI School of Medicine. And then from the funds that we've raised through the GoFundMe, we can make another 400 masks. And I believe that the 3D printing company said that they can crank out 100 masks a day.
Oh, wow.
So they're really in on this effort, and it's costing us $5 a mask because the 3D printing company is just charging us at their cost of, basically just cost of labor and
right.
cost of goods. Basically they're also in on this initiative, not making a profit. So we're really looking to donate these to the healthcare professionals and schools that need them. So really, we're not looking for any set, benchmark.
Okay.
Anything will help. There's a big shortage of masks, and these masks are really going to help limit the waste of these masks.
No, and that's wonderful to hear. And again, I commend all three of you for taking this initiative, and any dent that you all can make in the shortage of supplies that we're facing, it helps. So please keep doing your work, and we here are here to support you and all the future endeavors that you decide to take in fighting COVID-19.
Yeah, we appreciate that. We did also want to say for folks who are interested in helping, we'll also sell the masks at greater than costs, so that if they're willing to, or we'll accept straight donations, so that we can fund the donations of future masks. None of us are interested in really having any profit at all. Our sole goal is to distribute as many of these masks as possible. And so your listeners or anyone who wants to help can know that they can also obtain masks from us as well.
Of course, and we'll definitely be helping connect everyone to all of you, and whatever resources we can help provide, we'd be more than glad to. And with that, I definitely want to thank all three of you for your time. Thank you, Mr. Amir, Mr. Nick, and Dr. Schultzel. Thank you so much for joining us. And I really hope, this is a definite time of crisis. Thank you for all of your service, and thank you for, taking on this challenge that we're all facing. And hopefully, we'll definitely welcome all three of you back on the show, get an update on what ends up happening, and, also have a talk on a more lighter subject, and hopefully more engaging in terms of happiness. So it's a tough time, and this is a great thing that really will hopefully lift up spirits, and we're going to get through this all together.
Absolutely. Thank you so much for having us.
Thank you very much for having me. Appreciate it.
Yeah, thanks, Pav.
Best of luck, and take care. Please stay safe and stay healthy.
Thanks for joining this episode of Global Talks by PavLyfe with Pav and Lohia. Make sure to visit PavLyfe.com, where you can also subscribe to the podcast and read the PavLyfe blog for perspectives and news on everything healthcare you simply can't get anywhere else. Share your thoughts on the show by rating the show and by connecting with us on social media. Thanks for tuning in. See you in the next episode.